Well, now to a health alert. A troubling rise in children being hospitalized.
Officials say more and more children are being admitted with respiratory illnesses. Tamara Scott is live in Chapel Hill breaking down the data. Tamara?
Well, good afternoon. Well, the bottom line here is that the cases continue to rise across our state, and with that comes less and less space within all of our area hospitals. Now, with RSV, this is a virus that attacks the respiratory system and can be very harmful for young children, especially if they have any other sort of conditions like asthma. Now, today, UNC health leaders will be speaking with other leaders across the state to figure out how to help.
It's not typical to see this high volume of cases at this time of year. This is usually the beginning of the season. This is typically when we start to see the ramp up occurring, and so we start to make preparations.
Dr. Benny Joyner is Chief of Pediatric Critical Care Medicine at UNC Hospitals. He says in just the last week, UNC Health has seen 190 new RSV cases. Symptoms include coughing, wheezing, fatigue, and even loss or change in appetite.
Because there's so many patients coming in, there's a limited number of beds in the pediatric ICU, a limited number of beds on the floors, and so these patients need to remain in the ED. And as I said, the ED is wonderful in caring for patients who need immediate, urgent issues. They're not designed for long-term care. They're not designed for multiple day stays. And so you have limitations in what they're able to provide.
Duke Health is also seeing a high demand for pediatric beds. As of last week, they reported 241 positive RSV cases. Dr. Joyner with UNC Health says the meeting today with pediatric health professionals across the state will discuss how to help each other.
It does create some challenges in that, and it really weighs on you because we know there are patients that need care urgently, but there's just candidly nowhere in the state to send them.
Now, Dr. Joyner says that treatment for these cases varies case to case, but encourages parents to continue washing hands frequently, social distancing, and wearing a mask where you can. Also be on the lookout for symptoms, as if you catch them early, it could be better and you could prevent any sort of bigger problems to come. Tamara Scott, ABC 11 Eyewitness News.